So we saw that the OCP use has led to prevention of epithelial ovarian cancer. Now the shows that even the progestin only contraceptive pills, although have well studied, have been associated with the lower risk of ovarian cancer. And interestingly, association of the HRT, hormone replacement therapy, with the ovarian cancer risk is less clear, possibly conflicting, although HRT reduces the secretion of the gonadotropins, and it may also enhance the estrogen induced proliferation of the ovarian cells. And benign gynae conditions including endometriosis, then PCOS, pelvic inflammatory disease, they have been implicated in the pathogenesis of the epithelial ovarian cancer. And the underlying the host susceptibility to implementation of the exfoliated Mullerian epithelial cells from the endometrium, endometriosis, and fallopian tube, that is endosalpingosis, may lead to the development of epithelial ovarian cancer, with Pierce et al. Reporting an increased risk of low-grade serous ovarian cancer with an odds ratio of 2.1, and endometrioid ovarian cancer and clear cell cancer. ARID 1A mutation have been reported in the endometriosis associated ovarian cancer. ARID 1A associated with the endometriosis associated ovarian cancer. And in addition to the increased risk of endometrial cancer due to production of the unopposed estrogen, endogenous estrogen, and elevated androgen in women with PCOS, the cancer and steroid hormone CASH study reported a history of PCOS among 7 out of 476 patients with epithelial ovarian cancer compared to 24 out of 4,000 control. And finally, although PID causes inflammation of the entire reproductive tract, including cervix, endometrium, fallopian tube, and ovaries, the studies linking this PID to epithelial ovarian cancer have been inconsistent. And gynecological procedures including hysterectomy, total tubal ligation, have been associated with a reduction in the ovarian cancer ranging from 30 to 40%, presumably due to interruption of some of the blood flow to the ovaries. And risk reducing salpingo-oophorectomy is recommended for women harboring BRCA1/2 mutation after completion of childbearing. And importantly, RRSO does not eliminate the risk of entirely, because there is still approximately 1.8 to 2% risk of development of the primary peritoneal carcinoma. And women with BRIP1 mutation have had a strong family history with the either negative BRCA1 status or unknown mutation status also benefit from RRSO. And among environmental risk exposures, talcum powder has been renewed interest recently, and talcum is a silicate. So although animal models do not support the evidence of carcinogenicity, some epidemiological meta-analyses have reported an increase in the risk of approximately 35% associated with the genital exposure to talc. And this results were refuted by the Women Health Initiative study in 2014 involving a cohort of 61,576 postmenopausal women, but other investigators have found a positive association with the genital talc exposure in certain subgroups, including premenopausal women, postmenopausal women using HRT, and women with certain variants of glutathione S transferase M1 and glutathione S transferase T1. Now, if we look into the anatomy and pathology, ovarian cancer arises in the adnexa, which consists of ovaries. Now, adnexa consists of ovaries, fallopian tube, broad ligament, and embryological rest within the broad ligament. And the three main types of the ovarian cancer include the epithelial cancer, malignant germ cell tumor that arise from the primordial germ cells or oocytes, and the sex cord stromal tumors, which are derived from the steroid producing cells responsible for nourishing the germ cells and oocytes. And interestingly, the specific malignant histological type of ovarian cancer has less prognostic significance than the international FIGO stage. Extent of the residual disease following cytoreductive surgery and histological grade, particularly in case of epithelial ovarian cancer, histological grade is an important independent prognostic factor. So grade is an important prognostic factor, and WHO histological classification of ovarian cancer is here in table. So this classification shows that there are serous tumors, then benign tumors like cyst adenoma, papillary cyst adenoma, surface papilloma, adenofibroma, then borderline are papillary cystic borderline tumor, papillary surface borderline tumors, then adenofibromatous cyst adenomatous borderline ovarian tumor, then malignant like adenocarcinoma, serous, low grade, high grade, papillary surface carcinoma, adenocarcinoma, and then mucinous are benign like cyst adenoma, adenofibroma, mucinous cystic tumor, cyst adenoma, adenofibroma, mucinous cystic tumor of myxoma peritoniana. Then borderline is intestinal, endocervical, malignant like adenocarcinoma, mucinous carcinoma, and third is endometrioid, benign cyst adenoma, adenofibroma, endometrioid cyst adenoma. Then borderline is cystic tumor, adenofibroma, atypical proliferation of endometrioid tumor, and malignancies adenocarcinoma, not otherwise specified, adenocarcinofibroma and endometrioid carcinoma. So in a descending order of frequency, epithelial ovarian cancer includes serous cyst adenocarcinoma characterized by psammoma bodies. So epithelial serous cyst adenocarcinoma, which is characterized by psammoma bodies histologically, and elevation of the serum CA125, and endometrioid carcinoma, undifferentiated carcinoma, clear cell carcinoma characterized histologically by Hobnell cells. So clear cell contains, it is characterized by Hobnell cells, and clear cell carcinoma, they are characterized by coffee bean nuclei and Hobnell cells. Coffee bean nuclei. And epithelial ovarian cancer, it is characterized by psammoma bodies. So mucinous cyst adenocarcinoma not associated with CA125, but there is increase in CEA, and serous carcinoma can be high grade or low grade, and clear cell carcinoma, undifferentiated carcinoma tend to display the most aggressive is clear cell, and undifferentiated carcinoma confers worse prognosis. And it is important to note that there is a benign and borderline malignant counterparts of the first three tumor types, and benign lesion includes serous cyst adenoma, mucinous cyst adenoma, endometrioma, whereas malignant doppelgangers include tumors of the low malignant potential of each of these histological types.